guys, welcome back to my channel. Myself Dr. Hilary. I'm currently pursuing my masters in prosthetic dentistry, crown and bridge, and also a part-time YouTuber. So guys, NEET MDS is around the corner, and with that this video is about how to solve MCQs during your exams. Okay, so there is a huge difference. You solve those MCQs here in homely environment with a quiet and peaceful mind, and you solve MCQs there in the examination center. So in this video I'm going to share with you few tips which you should keep in mind while you are there in the examination center, the way you need to train your mind. I think this is the right time, as there are few days left just before the NEET MDS 2022. You should know these things and you should start practicing these things while giving your GTs and mock test as well. So stay tuned till the end and do share it with your friends. Okay, so guys, here we have few MCQs from FPD Prosthodontics, and I think it will help me to convey my message to you all. Okay, so for the coming few minutes, please pay attention here and stay focused. Okay, so see, let's read the first MCQ, which is that an accurate medical history helps in deciding the treatment methodology, in identifying the possible risk factors for dental faculty, in assessing the oral manifestation, and D is all of the above. Okay, so it is very simple, straightforward, which is all of the above. Okay, so what I'm saying is that in the first 15 to 20 minutes, or maybe first 30 minutes of your paper or of your examination, what you will do is that you have to only solve MCQs which are very straightforward, which are very easy. And in MCQs like this, where the option of all of the above is given, okay, in 90% of the time it is the answer. Okay, 90% of the time, but do not take it as a last statement. Okay, but in most of the time this is the answer if all of the above is given. Okay, but it might get trickier when they add none of the above and all of the above as in the answers or as a one of the option. So just read the question and answers properly. But the first thing which I want to say is that in the first 30 minutes of your paper, what you will do is you will just attempt the MCQs which are very direct and where you have a, no doubt in it. Like, yeah, this is the answer. Okay, like our first MCQ. Now let's move forward. Following are systemic conditions that affect the periodontium except. सो कई बार क्या होता है ना कि स्टार्टिंग में स्पेशली जब आपका टेस्ट शुरू होता है, यू आर इन सो मच ऑफ हरी, सो मच ऑफ स्ट्रेस दैट यू डोंट रीड दिस एक्सेप्ट एंड चूज योर आंसर इनकरेक्ट. ओके, सो ये मिस्टेक्स हमें नहीं करनी है. ओके, ऑलरेडी कंपटीशन बहुत है, हमें आगे ऐसे बढ़ना है कि हमारे मिस्टेक्स कम हो. ओके, सो read carefully that what question is asking about. Okay, and leave such MCQs for your second round. Okay, first round में आप जो भी easy है, factual है, वो questions करोगे, and in the second round you will take it easy, read the questions, process it well, and then you will choose. Okay, so following are systemic conditions that affect the periodontium. So diabetes surely affects, right? Pregnancy surely affects, ये हमें पता है. Epilepsy, not directly, but because of the epileptic drugs which we take, it affects periodontium. So क्या बचा? MPDS. Okay, so do it very nicely and you will be able to reach the correct answer. Okay, now let's move to third MCQ. Eroded teeth are a common sign of the following conditions except. Again, okay, so किस किस में eroded teeth दिखते हैं? bulimia. Okay, I know for sure that bulimia में eroded teeth दिखते हैं, and even in the anorexia nervosa. Now I'm not sure about the AIDS and hiatal hernia, क्योंकि ऐसे patients नहीं आते हैं जिनको hiatal hernia है and they have eroded teeth. The chances are very less. So, but if I'll think for more time, okay, my common sense tells me that AIDS is related to immune deficiency. Okay, compared to hiatal hernia, this is a good option to select, that it does not contain eroded teeth and it is the right answer as well. So ऐसे MCQs जिसमें आपको 4 में से 2 ऑप्शंस पता है और 2 में कंफ्यूजन है, सेव इट फॉर योर थर्ड राउंड. ओके, थर्ड राउंड के लिए सेव करोगे लास्ट 1 आवर जिसमें आप सॉल्व करोगे आपका वैसे MCQs जिसमें यू आर कंफ्यूज बिटवीन द 2, बिटवीन द 3, और you don't know the answer at all, so you will just read the question again and again and try to think about it. Okay, now moving to fourth question. Temporomandibular joint can be located by palpating just posterior to the auricular trachea, anterior to auricular trachea, anterior to auricular trachea while patient opens and closes the mandible, and posterior to auricular trachea while patient opens and closes the mandible. So it's a very easy for those who are who must have palpated TM joint. So it is not posterior, but it is, yeah, so it is not posterior, but it is anterior to the auricular trachea while patient opens and closes the mandible. Okay, right over here. So ऐसे questions आएंगे जिसमें they will play with the fact. Okay, एक ही fact है कि anterior to the trachea, but by adding the word posterior to it, they are just playing with your mind and they are trying to confuse you. और वो moment में when you will be under pressure and वो stress में you will feel like हाँ anterior था posterior भी you have this auricle na, so for that also we use it, so you might choose a different answer, but so here your concepts will help you, that how solid your concepts are and how clear you are about the basic things. Okay, so most of the questions you can expect that they are of from this basic knowledge of all the dental as well as medical subjects. Okay, now let's move forward. Auricular palpation with light anterior pressure helps to determine potential disorder in interior attachment of the disc, middle attachment of the disc, capsular ligament, and posterior attachment of the disc. So it's a very fact that it helps in the posterior attachment of the disc. But if you don't know, then I think you should not play in such cases, and it's a very safe choice to leave such MCQ where, in spite of taking unnecessary risk, it is better to avoid such MCQs, okay? Because we have negative marking as well. Then there will be straightforward factual questions like maximum lateral movement of mandible is how much? 10, 15, 12, 20. So it is like, if you know, you know, if you don't, you don't. So if you know, attempt it. Otherwise, don't guess among the numbers, okay? This is the biggest blunder. If you know it that, yeah, it's the 12 millimeter, the maximum lateral movement, then do it. Otherwise, do not. Ki, haan, maine kahi ye padha tha, wo padha tha. Don't do that, okay? It will just push you towards the negative marking. Now, the last MCQ, that Solberg, Krog, Paulson, and Olson described. Abhi, I have never heard about these authors. Okay, so the question is completely unknown to me, but I know that what is smile analysis, what is TMJ, lip examination, and comprehensive muscle palpation, but absolutely I have no clue in this question. So in such questions you will not attempt it, okay? Where you have no idea, do not take random risk. Okay, but just to let you know that they had described the comprehensive muscle palpation, and these MCQs are for prosto PGs, not meant for you guys. Okay, so avoid it. I just used it as to convey my message to you all. So to summarize this video, I would say that attempt your MCQs in 3 categories. Okay, number 1 is straightforward, easy questions, okay, and factual questions which you know in the first 30 minutes itself. Time ka bhi bahut dhyan rakhna hai, okay? And the second round, what you will do is where you have to think a little bit, read the question, understand the question, and then select the answers. Kai baar aisa hota hai ki hum question read hi galat kar lete hain, and then we choose obviously the wrong answer. Okay, ये चीज है आपको एग्जाम सेंटर से बाहर आने के बाद यू विल रियलाइज दैट अरे हाँ यार ये तो आता था बट ये कर दिया. ओके, आई एम श्योर दैट मॉक टेस्ट जीटी वगैरह देते होंगे आप लोग, तो यू मस्ट बी aware of this feeling, but now this is the last chance and here we do not want any mistake. Okay, and in the third round what you will do is you will read the remaining MCQs, okay, and just try that, okay, fine, am I able to make any connection? I can eliminate any of the option with my common sense or with my, general knowledge of the dentistry. Okay, if you are able to make any association among the question and answers given, then attempt it. Take calculated risk. I'm not saying that do not take risk at all. Okay, attempt भी आपको अच्छा करना है. So take calculated risk, but ऐसा नहीं कि in every other question you are taking like कि हाँ जैसे ये MCQ था 10, 15, 12, 20, maybe 20, maybe 15, and you are just attempting it. So here there are huge chances that you are losing your marks. Okay, so I hope that this video remained fruitful for you guys. Do share it, and if you are new to the channel, do subscribe it. And if you want to support my work, please do share about this channel and this video with your friends and your community. Thank you so much guys, and all the best for this final sprint.